you're free. Actually, what you're doing is you're killing the tissue around the warts. It has nothing to live on. I just did this for my granddaughter. Had warts all over her hand. Electrical current. You burn it with acid, but that is not very effective. Cryotherapy really is the best. They can do laser treatment, but then the virus can become aerosolized in the air. Genital warts, it's human papilloma, HPV 16, and it is associated with cervical cancer. So if you have this infection, you could later come down with cervical cancer. They have a vaccine against it. There's pictures of genital warts. Put them in the shaft of the penis, or on in the vagina, or on the vulva or cervix, and you can also get them around the nose. There's genital warts growing around the head of the penis, and you can see that skin, that kind of horny looking skin that grows. These are warts on the bottom of the foot, and because you have pressure on them when you're walking and stuff, they don't grow out, they grow into the foot, and they're a little more difficult to get rid of. I had one on my big toe for 10 years, and I had a baby. Yes?
Are those also the HPV?
No, this is just regular warts. Yeah. Yeah. It had a baby, so I went to a dermatologist, and it took a while to get rid of it. There's no one treatment for at least on your feet. Keep going back and getting the froze off, and I used to really almost scream, to be froze with this stuff. Now I can't believe it though. Now I do it to myself. I'm used to it now. Okay, another viral disease is smallpox. Smallpox that virus is variola. You need to know that. It's two forms. It can be variola major, which is a virulent form, has a 20% mortality rate, or variola minor, and that one has a less than 1% mortality rate. It is transmitted. You're seeing the stuff in the skin, but it's transmitted by the respiratory route. It's airborne. So early symptoms and signs are high fever, fatigue, headache, backache. Then the virus infects internal organs, and then it goes into the bloodstream, and then you see the skin reaction. So initially there is a macular rash, and those are going to become pustules in about 10 days. Smallpox was the first disease that we got the vaccine for. Remember Jenner, some exudent from a cowpox into the little boy to test, because the milkmaids told them that they got cowpox and they never came down with smallpox. So it was also the first disease that they eradicated. And they eradicated it in 1977. They figured the last case was in 1977. And the reason they were able to eradicate it is because humans are the only host. So it doesn't have a reservoir in the animal population. And so in 1977, that last case was in Somalia, and I think it was variola minor. But actually, after that, about 6 months after that, I can't remember the time, in England, I think think in London. They had a case, a fatal case, because some of that virus escaped from a lab. You know, so I don't know whether it was a worker that came down with it, but there was one more case after the last case. So right now, there are 2 sites that still have the virus. No longer do we have that disease, but we still have the virus. And that's kept in at the CDC in Georgia and then someplace in Russia. And they keep talking about destroying those virus, but then they keep postponing it too.
Why do they postpone?
They're probably each one thinking that they don't want the other country to have it and them not. Don't you think? Because now we have a whole population that is not immune to anything. And even though I've been vaccinated, anybody here been vaccinated?
Do smallpox?
Yeah, they don't do it anymore. But your immunity kind of wanes as the time goes on. You will have some immunity, but not like right after you get it. So they consider that it could be a weapon of terrorism because all these people that would come down with it, and now they don't have that much of the vaccine. They're still holding on to the vaccine, but they don't have a big stockpile of it like they used to.
I'm sorry, so that only 2 sites with virus, that means existing now? The only
Yes.
It doesn't mean that those were the only 2 countries that were affected?
No, that's where the stock of virus is.
Where they have it?
Yeah. That's in the RCDC.
Other countries are at a disadvantage then?
Hmm?
Other countries are at a disadvantage?
Yeah. Well, isn't that true?
Yeah.
I mean, in a lot of things, right?
That's good though.
Those are the 2 big powers. They're loaded with smallpox virus. There's a similar,
Control though.
huh?
It's kind of hard to control because it spreads so easily. It's not like a weapon that is more containable.
No, right.
I don't think you want to kill off everyone.
Well, sometimes there are people that run countries that are loony. They don't think of those things, do they?
Is it possible that the disease might come back eventually, like
What do you mean?
like in
It's
the
only
future?
virus?
They've gotten rid of it, so unless it escapes somewhere, I don't think it would reinvent itself. As we know it anyway.
I'll
Like
show
it
you.
wouldn't evolve from
We
like a
don't.
monkeypox to
Oh, good question. But monkeypox is similar to smallpox, and it can go from humans to, from animals to humans, so it's a zoonosis. But, you're right, you never know, do you? What it gets exposed to, and that might do something like that. Monkeypox is endemic to Africa and Asia, and usually it's among small animals and monkeys. So here are some pictures of the pox. Yeah, you get a blistering rash, there's a high fatality rate, high fever. Here's another showing the lesions on a man's hand. And this guy, I'm pretty sure probably didn't make it. I mean, he is just loaded with it. Chicken pox. This one's now called varicella. It's a DNA virus, highly contagious. You're contagious before that rash breaks out. It's a mild childhood disease with a low mortality rate. And if there's complications, it's usually encephalitis or pneumonia from chickenpox. But you guys don't see many of these things because now they vaccinate against everything. So for chickenpox, also the portal of entry is the respiratory system. It gets transmitted by droplets or fluids from the vesicles. And it localizes in skin cells in about 2 weeks after you've been exposed to it. Chickenpox is a herpes virus, varicella zoster, And early signs are a fever, headache, body ache, and then you get an itchy rash. And vesicles form, and then as a little kid, you scratch them, and they rupture and form a scab. So those vesicles form in 3 to 4 days, filled with pus and rupture and get a scab on them. Lesions are on the face, throat, back, and they can go on the shoulder and chest. They can cause fetal damage if mother is in her early pregnancy and gets the disease. It can cross the placenta. There is a live attenuated vaccine, attenuated meaning they tweak it some way so it's not, when you get that vaccine, you're not gonna come down with chickenpox. It's just gonna stimulate your immune system. But effectiveness declines with time, and so one thing that can happen that they think about is most people do not continue to get booster shots into their adulthood. Have any of you been going and getting booster shots? You don't get booster shots. And so then that can lead to a whole population of susceptible adults to chickenpox. There's the vesicles of chickenpox. Some more. We have a vaccine for it now. Reyes syndrome, and I remember when they discovered this too. It's caused by complications of chickenpox, influenza, or aspirin. And I remember the news talking about the aspirin and causing this they came up with this Reyes syndrome by a child or a teenager. After the initial infection has gone, the patient with this Reyes syndrome, the patient has persistent vomiting, drowsiness, and combative behavior, which indicates some brain dysfunction. They can go into a coma and death can follow, and there's about a 30% death rate with Reyes syndrome. And if you survive, then you may have some neurological damage. Shingles, the same virus, herpes zoster, as the chickenpox. So when we're talking about herpes viruses, they can all remain latent in your body. So after a primary infection of chickenpox, then that virus retreats up the peripheral nerves to the dorsal root ganglia, and it stays dormant there for decades, or it may never reactivate, but it's on the nerve as viral DNA.
Is it possible to get checked for it? Like if you had chickenpox before, then do you need to get checked up if you have the virus? Or if
To
it's
get
gonna-
shingles,
Mhm.
you have to have had chickenpox.
So is it a way of predicting whether or not you will get the shingles if you already had chickenpox?
No, but they pushed the shingles vaccine, so it must be a bunch. I had it, I was gonna take it off my phone and make
Can
a,
you still get the shingle vaccine if you already have the chickenpox?
yes. Yes, because if you didn't have chickenpox, you're not getting shingles.
Yeah.
So the virus can be reactivated and move down those peripheral nerves to the sensory nerves of the skin, and it is in an outbreak in the form of shingles. And